With a warm welcome, discussed here is the basis of medico-legal issues and how to address those. This presentation is comprised of Part 1 and Part 2. Part 1 elaborates the medico-legal issues, and in the Part 2, it emphasizes how to answer the medico-legal issues that had been identified. Part 1. One of the duties of a medico-legal expert is to identify the case-specific medico-legal issues and then to answer for those in a scientific manner. Unless such issues surrounding a case are identified, either in a clinical case or during a postmortem examination, no proper medico-legal investigation is possible. Important basic medico-legal issues. Judicial medical officers are not treating patients. Instead, they emphasize certain other aspects, such as identification of medico-legal issues surrounding a case. Then they investigate the case to find answers for the medico-legal issues that had been identified earlier. Mentioned here is a basic list that can be applicable for any case. The first one is specific identification of the deceased, cause of death and mechanism or mode of death, manner or circumstance of death, time since death, reconstruction of the incident, volitional activity or activities following fatal injuries. What do you mean by volitional activity? That means activities that the victim had performed after sustaining fatal injuries. Activities should be voluntarily done. Period of survival after fatal injuries, association of possible sexual assault, association of intoxication with alcohol and drugs, injury description and proper documentation, and proper sample collection and maintaining the chain of custody. Do you think that we are done? No. That list only covers the basic medico-legal issues. In addition to the above, you have to think about other specific medico-legal issues in a given case based on the circumstances, or rather going by your differential diagnosis or possibilities. Example, a death due to firearm injuries, a death due to road traffic incident, a charred body, a dead body recovered from water. As you can understand, there are many other medico-legal issues that are case specific. We'll move on to a case, that means a case of firearm injuries. So you have to think about general issues and also specific issues as well. Now, general issues, as we have mentioned earlier, like this. However, now we have to think about specific medical issues pertaining to firearm injuries. We have to think about type of firearm, number of shots fired, identification of entry and exit wounds, range of fire, angle of fire, direction of fire, and gunshot residue collection. Let's move on to another case. It's a pedestrian died due to road traffic incident. So general issues, same as above. And then we have to think about specific issues. Any contributory causes from the victim to the accident, primary impact injury, secondary impact injury, secondary injuries, runover injuries, and also to identify more specific injuries, either can be seen externally and internally, such as imprint abrasions or diffuse axonal injuries. A case of charred body. General issues, same as above. And once we come to specific medical issues, you have to think about the lecture note that you have been given or you have been taught with the charred body. So here we have mentioned about specific medico-legal issues, whether She was alive at the time of the commencement of the burn. Any contributory causes of the victim to become a victim, cause of the fire, the starting point of the fire, etc. A dead body recovered from water. General issues, same. And specific issues, we have to think about in relation with an immersed body. By the time that he entered water, was he alive? Any contributory factor from the victim? Alcohol consumption, etc. Let's move on to the part 2. Now we have identified general and case-specific medico-legal issues. Now we have to address, or we have to find answers for such issues. For that, we have to follow a methodical procedure that can be named as medico-legal investigation. It is comprised of 10-step procedure. The first one is authority, history, crime scene investigation, identification, preliminary investigations, examination of clothing, external examination. Here you have to do general and external examination, general and specific external examination, internal examination, collection of samples, providing cause and manner of death, including. Imagine a situation where medico-legal issues had been exactly identified, though the PM has been performed without a proper external examination. The postmortem has been completed without opening into all body cavities and without a proper internal examination, and had forgotten to collect blood or urine for toxicological analysis. That means you haven't followed a proper procedure to address the issues that you have been identified. Now you can understand, to find answers for the medico-legal issues that you have been identified in a case of postmortem examination, you have to follow a nice procedure that we can address all the medico-legal issues. Actually speaking, that medico-legal issue, addressing of medico-legal issues, that means medico-legal investigation, in other words, is comprised of a 10-step procedure. Ten-step procedure in medico-legal investigation in detail. The first one is the authority, history. Now, history we have to take from different parties, from eyewitnesses, relatives, past medical history, social history, drug history, and history of the enemies that he had got, and past suicidal attempts. Third one, crime scene investigation. You have to do it as soon as possible with the team and instruments. By visiting the scene, you can't take the final decision. However, you can take the preliminary idea of time since death. Similarly, preliminary idea of circumstances or manner of death, preliminary idea of cause of death, to collect trace materials and to reconstruct the events that had happened. Fourth one, identification of the deceased. If the dead body is fresh, we can do it with the help of two relatives. But if the dead body is putrefied or disfigured, then we have to adopt certain other procedures such as tattoos, scars, and then going even for DNA analysis. Fifth one, preliminary investigations. Now this point is really important to know. Now under preliminary investigations, there are 3 steps that you can do. The first one is photography, second one is x-rays, the third one is collection of swabs. It could be from bite marks or from genitalia. Sixth one is the examination of clothing. Clothing are really helpful in case of forensic medicine. Useful for identification. We can get abnormal smell, vomiters, torn areas, trace materials, and we can correct foreign bodies, blood stain pattern analysis. Seventh one is external examination. Under external examination, again, we can divide it into two basic parts. The first one is general external examination and the second one is specific external examination. Under general external examination, we can do basic stuffs such as we can take the hair length, height, teeth, tattoos, special marks, stage of rigor mortis, hypostasis, postmortem injuries, postmortem artifacts, iatrogenic injuries, and resuscitation artifacts. It is basically a very general list. Once we come to specific external examination, that means you have to pay much attention of your differential diagnosis. That means those are case-specific findings. In this case, you have to mark all the injuries possible. And also, according to the case presented, look for special findings. Example, in a case of asphyxial death, look for typical asphyxial features. In a charred body, you have to think about postmortem artifacts. And in a case of dead body, suspected case of drowning, you have to think about cadaveric spasm, presence of typical froth, signs of immersion. Let's move on to internal examination. Here you have to open each and every body cavity, and then you have to dissect all the organs and you have to inspect them properly. When necessary, employ special dissection techniques as well. Ninth one, collection of all necessary samples for toxicological, histopathological and biochemical analysis. Here, again, there are certain concepts that you have to understand. You have to collect adequate amount and also from correct places. That means it could be femoral blood and so on. Again, it's really important to think about. You have to do it as soon as possible into proper containers, and you have to get steps to store it properly and proper documentation and labeling. And finally, maintaining the chain of custody. So now this saying is a really important one. Not documented means not done. As the 10th step, you have to issue the cause of death and proper documentation as well. Now, so far we have discussed about post-mortem examination and the relevant medico-legal issues. Now let's move on to clinical cases or patients. Now here also, very similarly, first of all, we have to have differential diagnosis or we have to think about important medico-legal issues. Here also there may be general medico-legal issues that can be applicable to any case, and also it is case specific as well. The steps that we can follow are as follows. So to find answers to your medico-legal issues, now these are the steps that you have to follow in a clinical case. Examples for clinical cases, suspected case of child abuse, or abortion, torture, drunk driving, etc. Proceed your interest in the subject and good luck.